Hi, my name is Erin Weaver. I interviewed Miss Kimbra Hollingsworth for my social worker for this project. So for the first question, I asked her why she chose social work, and that is because she likes to work with other people and she enjoys problem solving. I asked her if she had ever had any past experience with other social workers, like as growing up and stuff, to help her find her way into this career field, and she hadn't ever had an experience with one, so that was something. She got her degree from Rock Hill University, and she did her undergraduate degree as a social worker. She did the advanced standing program through a summer while she was an undergrad student, and she applied to graduate school that following May after she graduated, and she got through it in a year. She graduated from undergrad in '86 and then graduate school in '87. What jobs she has held as a social worker: she has worked with adolescents as well as drug and alcohol patients, and she worked with geriatric patients, which was her favorite, and she said her least favorite was working with the adult psych patients. She now works at Promise Hospital in Shreveport, and she is on the medical floor all hours of the day. What she currently does doing that, she does psychosocial assessments with all of her patients and clients in the medical aspect of it, and she works with the treatment team to manage the treatment planning and discharge planning and any services that the patients will need, if they need any equipment, if they're going home, or if they're going to hospice care. She does all the paperwork to process that, and she helps with the transition back home to via home health, like I said. And if they will need any therapy, she goes ahead and sets that up for the patients and their families, and any other resources that they will need when they go home or if they go to hospice, anything like that. What is social work to her? It is connectivity is what her main thing she said, and assistance were the key aspects of what she does. She said, and I liked what she said it's like putting a puzzle together and having to look at someone's lifestyle and their advantages and disadvantages and how she can assist their needs. And what makes a difference between a skilled and unskilled social worker? She said, skilled, it's just looking at your past experiences and going off of that to see how you can better help your future clients, and look at your past cases and if there's anything from those that can help with the one you are working on now. If you don't have any experience, then you really have to pull from your academic work that you did in college. And she also said to help is try to find like an internship while you're in college to get the real life aspect of the work that you're going to be doing, and that really helps. She said it's a fun job if you let it be. There's a lot of work to be done with it, but it's very rewarding. Is there a good and bad social worker? Yes, there are. Okay, she said yes, but only because people are human and everyone makes mistakes, and sometimes it's hard to separate your own emotions when you're dealing with a client or patient, and be careful not to place your own thoughts and values on them. Make sure you give them as many options as they have, whatever they are. Be able to identify your own strengths and weaknesses to better assist your clients with the best options. So don't pressure them into choosing an option, just make sure you let them know what you think would be best for them. If you are trying to convince someone to be a social worker, this is what she said. She said that her job is very rewarding, and that if you want to help people, this is for you. There are many opportunities to help people, obviously. She loves that she gets to meet new people almost every day. She likes to work with the families to help their loved ones and help her patients to do all she can for them. and just to assist them and educate them on what's going to happen to them and how they can be helped. And she said that that is just priceless. She wouldn't rather be doing anything else. How does she practice self-care? She says that you need to laugh a lot. She laughs a lot. It's a very stressful job, and although the job is very serious, just make sure you are professional at work, and although it may be hard sometimes, just try to keep the mood light with the families, and just try to make the process as easy as it can be for them. Try to go out with your peers and your other employees just so you can have a better understanding of them and know how to work with them. Yeah, just laugh a lot is basically what she said. I also asked an additional question of how long the process is usually when you're dealing with patients, and she said the process is not very long. Obviously, you have some patients going straight to hospice, and you don't know how long they have with that, but the process is not long. If there's more to it, then you're just trying to help the family download what is happening, basically, and just assist them in any way you can, is what she said. But, yeah, so that was my interview with Miss Kimbra. She was very nice, and she seemed to enjoy her work and her job. So, thank you. Bye.